While seeking healthcare services, Kenyans are often referred mostly to private clinics to purchase medicine after getting a doctor's prescription. Lack of adequate medicinal drugs could be as a result of dependence on imported drugs. 70% of medicinal drugs in Kenya are imported, while the country's manufacturing capacity is at 30%.
In terms of facilities, they are well spread, but of course there are other resources. Beyond building and structure, you need to provide the right resources for that facility to actually bring value to the people.
What do we need to do to make sure that we have a steady and stable supply chain?
Dr. Rashid Aman's statement is well elaborated in a survey report by the Global Fund released earlier this year that indicated presence of not-for-sale drugs in private pharmacies that had been donated to Kenya.
We just need to have in place systems that will work for us, whether we are during stable times or whether we are in crisis time.
The Ministry of Health's partnership with the Ecumenical Pharmaceutical Network comes at a time when 37.8% of health services in Kenya are offered by the private sector.
To reach out to the most in need. You know, the CHF system and the institutions, facilities are located where the government is not so much present.
Meanwhile, the Biovax plant is expected to begin operations in 2023, contrary to former President Uhuru Kenyatta's command of the plant to begin operations in April this year. Ben Kirera, K24, Nairobi.